Today I want to talk to you about a subject that's close to my heart. I want to talk to you about SIDS. SIDS stands for Sudden Infant Death Syndrome. The Center for Disease Control and Prevention, or the CDC, states that SIDS is defined as the sudden death of an infant less than 1 year of age that cannot be explained after thorough investigation is conducted, including a complete autopsy, examination of the death scene, and a review of the clinical history. The CDC also states that more than 4,500 infants die suddenly of no apparent and obvious cause, and that half of those are due to SIDS. This has made SIDS the #1 cause of death in infants ages 1 to 12 months. SIDS affected me at a young age. I was 10 years old when my 4-month-old cousin Miranda died of SIDS. It was a typical work day. Her parents dropped her off at the babysitter's that morning and went on to work. At lunchtime, the babysitter's husband had come home and played with Miranda for a little while. He put her back in the playpen and went back to work. A few minutes later, the babysitter walked by and looked at her. Miranda was blue around her lips. She immediately started CPR and ran with the baby across the street to the police station. She was brought to the hospital where they worked on her all night, but she couldn't be saved. When everything was over, her parents were told she had died of SIDS. So far, I have explained to you what SIDS is and my experience with it. Now I would like to give you some risk factors for SIDS, which I found on mayoclinic.com. Boys are usually affected by SIDS more than girls. The age when most SIDS cases happen is between 2 to 3 months old. Any infant is susceptible, but it's more prevalent in African American, American Indian, and Alaskan Native races. Having a family history such as a sibling or a cousin die of SIDS is also a risk factor. Some maternal risk factors are the mother being under the age of 20, the mother being a cigarette smoker, the mother in drugs or alcohol, and inadequate prenatal care. I've told you what SIDS is and some common risk factors of SIDS. SIDS is unpreventable, but I'm going to tell you some ways to reduce the risk of this happening. One way is to place infants on their back to sleep at all times. This includes during naps, or if they fall asleep in car seats, strollers, or swings. They should be moved to a flat surface as soon as possible. The only exception is if the child can already roll from their back to their stomach. Put the infant on a firm sleeping surface, such as a crib or a bassinet, and cover it with a fitted sheet. There should be no blankets or padding underneath. There should be no loose bedding in the crib or bassinet. This includes no pillows, quilts, comforters, bumper pads, or stuffed toys. Infants should be in the same room, but not the same bed. They should be in a crib or bassinet. If the baby sleeps in the same bed, they are at risk of suffocation, strangulation, or having a parent roll over on them during sleep. They could get tangled in the covers and suffocate. Breastfeed as long as possible, at least 6 months if possible. Take your infant to all checkups and be sure to get all immunizations. Be smoke-free. If you smoke, try to quit. Keep your car and home smoke-free. Don't have your child near smoke or in places where people have been smoking. Don't get your baby too hot. Keep the room at a comfortable temperature. Dress the baby in no more than 1 layer of what you would wear. Check the baby's skin for sweating and to see if they feel hot. Pacifier use has been shown to reduce the risk of SIDS, but if you are breastfeeding, wait until that is established before you introduce the pacifier. Cardiorespiratory monitors and products that claim to reduce the risk of SIDS have not been shown to be effective. Some may actually cause harm. These measures and more can be found at healthychildren.org. In conclusion, I have defined SIDS, told you risk factors for SIDS, and given you information to help reduce the risk of SIDS. I hope you've learned some new and interesting information from my speech. Thank you.